According to the American Academy of Orthopedic Surgeons, lower back pain affects 4 out of 5 Americans. If your lower back pain includes a sharp, often shooting pain that extends from the buttocks down to the back of one leg, it could be caused by a herniated disc. Other symptoms include weakness in one leg, tingling or numbness in one leg or buttocks, loss of bladder or bowel control, a burning pain centered in the neck. The specialists at Gulfcoast Spine Institute explain disc herniations and how they can help alleviate your pain.
85% of us at some point in our life are going to be disabled with spine problems, spine pain, or spine-related injury. Especially in Florida, elderly population being quite active, we see a lot of backache. We also see a lot of extremity problems that are related to the spine. The patient might not understand that their leg hurts because they have a disc herniation or stenosis or bad back, or their arm may be numb or weak because they have a neck problem, a cervical disc problem. We do see a lot of sports and recreational related and age related pains that are all pointing back to the spine as the initial culprit. Disc herniation is when the soft cushion material that normally resides between the bones, providing a shock absorber, gets pushed out of its encapsulated area, and typically gets pushed out and becomes a problem if it pushes out towards the nerves. So the nerves are behind the disc. So if you're doing something strenuous, heavy lifting or bending, or a combination of bending, lifting, and twisting, or you take a hard fall and you get a lot of pressure on your back, you can squeeze out that jelly inside portion of the disc. It ruptures through the wrapper. And then if it ruptures towards the back and happens to be pushing on a nerve, then you get that nerve-related pain. So patients will come in not just with back pain, but with pain radiating down an arm or a leg, depending on which nerve is being irritated. I think what sets us apart at Gulfcoast Spine is that we do almost all of our surgeries in the lumbar spine through minimally invasive techniques. Almost all of my lumbar surgeries, whether they be just simple decompressions or fusions with instrumentation, I can do them all in a minimally invasive fashion through small incisions. So when you do something with little incisions, you have much less blood loss, much less post-op pain. And more importantly, you're not destroying the back muscle to get down to the backbone. You're leaving the muscle attached to the bone so that the patient doesn't have to rehab that back muscle. We have very little blood loss, extremely low infection rate, and a very quick return to normal daily life and activities.
For more information about the services available at Gulfcoast Spine Institute, please click the herniated disc story icon on our homepage, yourhometownhealth.com.